I'm Dr. Mark Sue, and welcome to the Functional Medicine Reality Podcast. Join me and our community weekly as we bring you unfiltered health from inflammation to longevity. Real stories, real people, real solutions. Experience real-life health changes from both patients and practitioners, and learn how to turn cutting-edge information into real results in your own life so you can feel better, live longer, live healthier, and be confident and clear in your healthcare choices. Let's get real and get results. All right, folks, welcome to the Functional Medicine Reality Podcast. This is Dr. Mark Sue, your host again. And today I'm with Dr. Mike Melander. He is a chiropractor in our town. And there are, as always, specific reasons that we, on behalf of RootSeek Health, are inviting people to the podcast. So let me do a quick intro bio. And then I didn't tell you, Mike, but there's going to be a lot of glazing on you today, as like the young people like to say these days. All right. So just be okay with that. So
Bring it on.
look, Mike Melander, he's a chiropractor. He's been in clinical practice for 16 years. He's not once, a multiple time Best of Boston winner. Like it's kind of cool and fun to say Best of Boston winner, right? Multiple times. And he's an instructor for the active release techniques, which is what we're going to kind of focus on a bit today, which is about soft tissue injury treatment system. He's been instructing since 2017. So I'm always interested in knowing patient feedback, the reputation of practitioners of all kinds around the area, right? But historically, so before you were in town, right, there were two practitioners who did, MSK work, musculoskeletal work. Sometimes I just like to call it body work with patients, who just had all the super great reputation. One of them, unfortunately, she's passed away. And the other one was someone who, my understanding from patients about what was so great was that they did ART, right? So then when you guys came into town, I was like, okay, so there's more people who do ART, cool, because I understand that that's really effective. But here, let me just jump forward. So as you know, our oldest son, we have 4 kids, right? So our oldest son, he is going into senior year of college, and he is majoring in kinesiology, and he thought about doing like PT or something like that as a career. He did a summer internship. I think you know this. 2 summers ago in PT in town. And he was like, I can't do this, Dad. Like, it's not for me. It's kind of like road. It's boring. It's blah, 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 blah. And I'm not trying to be negative, right? I'm just his words. I say, hey, there's a lot of different forms of what goes on out there. Like, don't get all just tunnel visioned into that's what it all is. So another year goes by, next summer. So last year, he's having complaints of various this and that. I said, hey, why don't you let's go to North Shore Spine and Sport, right? So I said, I quite honestly, I hadn't met you guys. I'd like to kind of get a firsthand view myself. And in any case, we went together. He sees your buddy, Tim. And I kid you not, no solicitation. We walk out to the parking lot and he turns to me and says, Dad, that was cool. That was awesome. And he says, I could see myself doing that. I was like, wow. And like, it's one of those things, like as a dad, it just makes your heart like full and melt. And you're like, you can't buy that. Right. I mean, it literally, I'm not trying to play this up, whether for you or for podcasts or whatever. It was like a total heart moment. Like you just love your kids to be feeling that like excited about something. Right. I was like, I told you there's other ways. Right. And then you may not know this, fast forward further, he still talks about like all the benefits he gets working with Tim. Okay. And you guys as a whole, Tim specifically, he just went on this crazy, he did the Traverse, the White Mountains, I think it was a week ago. I mean, all in one day, right? I don't know, 10,000 elevation square feet. I don't do all that, but people who know this stuff, 10,000 square feet in one day, or feet of elevation one day. I forget how many miles, was it 25 miles or something like that, right? And then he's telling me like, yeah, at the end, my 2 buddies, their knees were hurting. They decided to take a shorter route. It was 5 miles. I did 8 miles at the end. I got back to the van like 10 minutes after them, right? And he's like, and it's so awesome. Like a year ago, my knees have been killing, blah, blah, blah. He's like, my knees, like they kind of ache the day after. He's like, but man, it's like, it's so awesome, like what it does, right? So that's just a brief intro, and I'm going to give you one more glaze, all right? Yes. Literally before we get on the podcast, I got a text from a patient. And again, so this isn't to take away from you, okay? Because just coincidence, right? Here's a text literally from this patient. Tim is the man. So happy with the results. No medication and 80 to 90% relief, right? I mean, I was like, oh, well, that's a great coincidence. I'm going to throw that out there. So all that being said, let me shut up here. I want to just start out, if you don't mind, because I think a lot of our patient audience at least through our primary care practice and whatnot, may not be that familiar with chiropractors. So if you don't mind, if you want to throw anything more about your own bio and then or your practice, but also pivoting into the spectrum of chiropractic work as a sort of field or industry, whatever you want to call it, the practice of chiropractic care, and then any kind of insights that you might have about that overall, and then where you guys kind of fit into that environment.
Sure. So I'll start, I suppose, with my own background story, and that is that really since I was a kid, going to a chiropractor was a relatively normal thing in my family, that my mother had gone since she was young. And then I went, periodically growing up. And, for example, remember playing lacrosse, getting clobbered on the field, going to the chiropractor, feeling good as new. And when I'm getting old enough through high school, there, I was thinking that's pretty cool. That I'm into this, right? And so I go to college. Sorry,
What part of the country is this?
yeah, I grew up in Massachusetts. Yeah,
Okay, all right.
so not too far from where we're talking right now, Mark. So I go to college and I'm studying medical laboratory science, and which is sort of funny is I chose that degree without really knowing exactly what it was, but I knew it was an easy way to get pre med requirements done. Because even going into college, I thought, like, I'm pretty sure I'm gonna go to chiropractic school.
Wow.
So,
Okay.
medical laboratory science, you learn to be a medical technologist, and for the folks that don't know, a medical technologist is doing lab testing, whatever it is, whether it's blood or tissue samples, and, play a large part in diagnosing an actual, like, condition for a person, or, like, saying, "Hey, you have a clean bill of health," basically.
Yeah. Yeah.
So I have this degree then in really hard science, right? And this makes sense to me. And so I get to chiropractic school, and pretty quickly I'm really disenfranchised because there is this focus on really what boils down to philosophy and what is sort of an antiquated, frankly, belief system about
Mm,
what it is chiropractors do.
hmm
So if we go back long enough, I don't know, from now 150 years ago or whatever it is, chiropractors then thought that the spine was the center of disease, and that effectively misalignments, and if I digress for a moment, a term I don't love very much, but a misalignment of the spine would lead to all sorts of systemic health issues because of the relationship of a vertebrae or vertebrae, if you will, to nearby nerves. And so let's get back to me now in chiropractic school. There is this ongoing belief, this dogma, and I'm like, this doesn't make sense for me. It doesn't make sense for me just personally. It doesn't make sense based on my education to this point. But I've felt the benefit of this. I've seen the benefit of what some chiropractors can do for others. So, well, we'll see this through. And I get to the end of school and I'm trying to figure out, like, where do I fit in this world, right? Because I know that a lot of the type of care that's been advocated to me throughout, my time in chiropractic school, that didn't make sense.
Hmm.
And so I was fortunate to get
And by the way,
connected
was that
to,
4 years, 3 years? How long was that?
yeah, it's about 3.5 years from start
Okay.
to finish or
After
thereabouts.
college, after 4 year college.
Correct.
Yeah.
After
Okay.
after college. Yep,
Okay.
after college. So, I went to college in Vermont, went to chiropractic school in Florida. I got smart and lived where it was a heck of a lot sunnier and warmer for a few years there. Yeah. So I get connected to a chiropractor who has what's called a diplomate in sports medicine. And this basically means that he pursued what probably amounted to 2, 3 years of post grad education in sports medicine practice. And I went and spent a morning with him and immediately thought, like, this makes sense. This is how I can approach this. And I shook his hand after a few hours and, like, thank you. Thank you for showing me there's a different way to this. And as it happened, I went on and I interned for that guy for the last few months of my time in chiropractic school, worked for him for a few months thereafter, and then was presented with a pretty excellent opportunity to take over a practice in downtown Boston. So around this time, I am increasingly interested in, say, sports injury, which in most cases boils down to soft tissue injury.
hmm
And a lot of the type of learning I'm pursuing is how to manage these things better. And I've been aware of ART, active release, for a few years. And I said, all right, I'm going to go to a seminar.
So that
And
wasn't what that wasn't what that mentor was practicing though.
so not he was not an ART provider, but he did a ton of soft tissue work. And at least at that point in my progression in my career, I saw that there was a different way to approach care that made sense to me, that it felt honest, right? And frankly, that was probably the biggest thing is that there was no kind of misleading of people or just perpetual treatment cycles that just never end. It was like, okay, you have a shoulder problem, we're going to treat it or whatever. We're going to evaluate it and here's the plan. Either we treat it or you're going to rehab it, and when it's better, call me if you need me. And
Hmm.
I get this,
So
okay?
you're touching on 2 points here, and I won't go into them, but because I don't want to interrupt you. But one of them is that there's even under the obviously under the umbrella of chiropractic care, there's a lot of different modalities, a lot of techniques and such.
Absolutely.
Yeah,
Yeah.
because I mean, I'll just say, I think I've told you, or I know I've told Tim that I have a lot of colleagues who are chiropractors, and one in Minnesota educated me, right or wrong, I don't know, over a year ago. Mark, there's like over 160 different forms of chiropractic techniques. And I was like, what? I was like, I told him, I was like, I think there's got to be at least over 20 is my sense. He's like, Mark, it's like over 160.
That's funny. So that's funny. I don't know that I would have known that number. So yeah, I suppose I can to kind of take a sidetrack for a moment and say, yeah, there's a lot of different styles of chiropractic care. What may now be, in my opinion, a more traditional approach to care is entirely spine focused
Yeah,
and
right.
predicated on manipulation of the spine, or what many chiropractors call an adjustment of the spine. Then there are learning pathways that may gear someone, like I've said, towards sports medicine or neurology or radiology, right? There's animal variations these days, which I quite honestly don't know the first thing about treating any animals, but these examples are out there. I saw a YouTube video once of a chiropractor adjusting the neck of a giraffe, so
That's got to
it's
be entertaining. We got to check. I'm
yeah,
going to go
this
check that out.
it's some clickbait, that's for sure. So where was I? So decide I'm going to take an active release technique seminar, and I go out to San Diego for it. And generally, the way the seminars are structured is we lead into it with about an hour or so of just some education in terms of lecture, and this is why we're doing what we're doing, and like, okay, so I like this so far. And then we get into the real practical application of this system, and immediately I thought to myself, like, this is what I've been looking for. This is what I'm gonna do, right? Like, this is really where I'm gonna direct the significant amount of my focus clinically. So within a year, I had taken, I don't know, 3 or 4 seminars for active release at that point. I think by the end of the second year, I redid all of those courses.
Wow.
This is the better part of 15 years ago. So active release education pathway has evolved quite a bit since then.
Okay.
At that point, there was really just 4 courses you could take. Those were either an upper extremity course, a spine course, a lower extremity course, or what at the time was called a long tract nerve entrapment course.
And now how
So
many
I
are
did
there?
all of these things. Say that again.
Now how many are there if there was 4 before?
We have,
8,
I,
10,
I want to say
15?
9 now.
Okay. 9, sure.
So now it is still, we have an upper, a lower, a spine. We call those level 1. Those are kind of the introductory courses. Each tend to be about a 3-day obligation. We have now what we call level 2 of upper, lower, and spine. The nerve course that existed years and years ago has been expanded quite significantly from what was at the time a 1-day course to now a 3-day course.
Yeah, so
Um,
this whole thing has grown quite a bit.
but yeah,
I mean, it's more than
quite a
doubled
lot.
in, 15, 10 plus years or whatnot. So, and you're
Right.
saying that at the beginning when you were experiencing this, you were like, yeah, this is enough. You're inferring it was aligned enough with what you experienced with that mentor internship and, that experience. And then it was something more apparently.
Yeah, what it was is it felt so specific, okay? Which hopefully I can expand on this idea of specificity throughout our conversation, but it felt like it was teaching me how to really target a problem in tissue and change it with oftentimes a measure of immediacy.
Okay.
And up to that point, the variety of soft tissue treatments that I had been exposed to and may have been using clinically, they didn't feel that good.
I
They
see.
were useful, and some things that to some extent I would still utilize today circumstantially, they didn't feel as focused, as specific as ART. Yep. So, at this point, I'm practicing in Boston. I've done a ton of ART. Back in those days, even in downtown Boston, there wasn't too many ART providers. I'm getting a lot of referrals for ART, and little by little, my practice grows organically. I get to a point now about, I think, 5, 6 years into my practice in the city. I'm presented with an opportunity to take over a personal training business, which I convert into a bit of a wellness center down there. Operate that for a few years. That was one of the times that we were a Best of Boston winner. And unfortunately, about 6 months after we won Best of Boston, COVID hit.
Yeah.
And I was kind of faced with this reality of many of the services that I'm operating in this facility are not essential. We had, you know, as everyone remembers, no clue when work would resume.
Yeah.
And so I'm home for a couple of weeks. And at this point, I've been in Boston for 10 years. I've been commuting 40 miles one way, for a number of years there. And I looked at my wife and I said, I don't want to go back to Boston. That it felt like that, that I suppose in COVID was an opportunity to make a life change. And I did. And we moved to Newburyport, opened up a practice a number of months later. And now we're over 5 years into that practice.
Yeah. And and thriving and growing,
That's right.
continuing very well. So you've kind of you've on a very high level talked about how it differs, from just your experiences with how ART practice differs from maybe, as you said, antiquated or maybe just older, historically established chiropractic practices, knowing there's a lot of different modalities. For someone who might be listening who doesn't who's never been to a chiropractor, right? And you could, hey, correct me if I'm wrong, but when I was growing up in Indianapolis, I don't know if I've ever heard of the term chiropractor. Maybe I was just so sheltered, okay? I don't know, but I don't remember any friends actually talking about it. And my parents, they're from China and Taiwan, so that's a different story, okay? But I don't know that I was familiar with chiropractors, and even in medical school, I don't know that I remember any patients or colleagues or anybody talking about chiropractors. So I don't know if it's like a huge regional differences or whatnot, but for anyone who's not familiar, okay, let's just shift over to like PT. And again, we're not trying to like throw shade or, criticize, judge or whatever, but what's a meaningful difference between what you do with ART and PT on a high level to someone who doesn't understand?
Yeah. So there's a lot of nuance to answering this question, Mark. And the
Okay.
first thing I'd say is that there's a lot of PTs who are excellent ART providers. Okay. That it is not a discipline unique just to chiropractors, right?
Right.
I'd say
ART
these
is
days,
independent of PT or chiropractors in, as you
that's
say,
right.
philosophy, dogma, and
There are
foundation. Right.
there are massage therapists who
Mm.
are trained in ART,
Oh,
athletic
wow.
trainers. Over the years in the seminars that I've taught, we've had orthopedists, we've had sports medicine doctors,
Oh,
I've had
wow.
some nurses, which they're usually a deer in the headlights, and
So,
I don't
so
mean
this,
this as a shot at nurses, just that they're like, wait, what are we doing to this muscle?
So we should pause on that just for a second, okay? Because
Okay,
you have investment interest in the ART world, right? So if someone's listening who's a trainer or as you said, could be a massage therapist or a nurse, like could they be someone who doesn't even have any medical background training, or what are the criteria, just really briefly, to be able to go do ART training?
yes, you have to have a license effectively to touch a patient,
Okay, so
whatever
some
that
kind
may
of
be, right?
healthcare professional, something or another.
That's right. Yeah,
Okay,
exactly,
sure.
exactly.
And then if someone's
But
listening and they're like, hey, this sounds awesome, and I know about this from blah, 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 and they're like, wait, I work with a massage therapist. I should tell my massage therapist about this. Like, hey,
yeah,
feel free, right?
that's right. That's
Okay.
right.
All
Yeah,
right.
yeah. In fact, a recent patient of mine who is a massage therapist was quite inspired by the technique and is going to be going to get certified in the system within the next couple of weeks. So
Good. Okay. Sorry to
pretty
interrupt.
exciting. That that's okay. Okay, so I suppose like what is different than maybe I go back enough years, say traditionally between chiropractors and PTs. I'd say traditionally physical therapists utilize almost exclusively exercise as an intervention. Okay, and traditionally chiropractors would utilize adjustments, joint manipulation as almost their singular approach to care.
Of the of the spinal column,
Of the spine. Yeah, and
largely.
certainly of extremity joints as well. So, over the years, and I would assume this happened just organically, certainly, like, chiropractors are probably increasingly interested in doing actual rehab strategies with people, and physical therapists are increasingly interested in sort of various forms of manual therapy, so hands-on care, and there ends up being a lot of crossover. And now in 2026, there are absolutely chiros who still only do manipulation of the spine, and there are physical therapists who exclusively do exercise intervention. But one comment I have with my patients all the time is that I believe the best chiropractor or best physical therapist these days should be largely indistinguishable. That we're drawing on the same body of evidence that says that for this type of condition, that this is probably the best way to approach this. And ultimately, like, we're treating all of the same people. There's been some interesting studies that I've come across over the years. One that I often reference to folks too that indicated that when chiropractic care, and I won't define what it was in the study, they kind of just said chiropractic care and physical therapy was combined, that the level of patient satisfaction was higher.
Hmm.
This makes sense to me because even in that circumstance, let's assume that that's just the traditional application of those disciplines. Well, then the individual on the receiving end of the care is getting hands on work that probably just made them feel better. And then they're getting exercises that really helps them stabilize and hopefully mitigate recurrence of that issue long term. So, to my point, that the best version of either discipline now should be well versed in all of these things, right? Be able to treat issues with some form of hands-on therapy, and be able to really efficiently.
So if I can rephrase that a little bit, or sort of put a little bit of a, I don't want to say spin, but sort of interpretation on it. What I'm thinking about there is there's two things I could pull from that as a sort of parallel from like what I might do personally, or what we do a lot in RootSeek in a totally different way, right? Not body work, if you will. But one is, hey, a stack is often more effective than a singular approach, right? So multi-dimensional or multifaceted kind of approach in this study case, like someone's getting two different maybe philosophical or construct approaches to the care, but the combination is more effective than just one. And then the other thought that crossed my mind is if we were able to find the sort of common ground and sort of dare I say root source or root cause. This is, people talk about root cause all the time, right? But in the way of, in this case, structural level root causes, then we don't need to like label it as PT or chiropractic or one of the 100 plus or 150 plus modalities of chiropractic care, or how many different forms of PT care there might be. We're just trying to deal with a structural root cause. Is that fair, or is that a fair interpretation of what you're talking about? Or
I think so. And I'd add that in the overwhelming majority of cases, the reason someone is seeking the care of a chiropractor or physical therapist is because they're hurting, right?
sure,
And
yeah,
we can agree, and perhaps we'll go deeper in this rabbit hole, but pain's a really complicated experience. And there's a lot of different ways to influence the experience of pain. And we have pretty good data now that indicates that varieties of hands on manual therapy will influence perception and thereby influence pain. And we know that exercise as a system, and we can perhaps go into greater detail, but just generally, exercise is arguably the most important thing a person can do with pain, provided it is within certain parameters that are more than anything not aggravating of the problem. So when we combine these type of strategies, hopefully we're given people at least some hope at first, right? And then in time really changing the experience of pain that they're having.
yeah. Well, if it's okay, let me ask you for if you wouldn't mind giving a couple examples of patient cases, whether it's individual examples or maybe more broadly, whether it's for privacy purposes or just there's a recurring theme and trend of observation of. No doubt, it'd be obviously, to the skeptic here, we could say, hey, okay, so it's biased because you're an ART provider and you have a lot of. But we could be fair and say, do you have any reflections on what are common, what kind of common presentations do you see of patients who they've worked with PT or chiropractors of whatever sort, and then they find you somehow or another, and then they find like, wow, yeah, this is meaningful. I mean, not just meaningfully different, but I've gotten so much better, much more fast, much more quickly. And to be fair, are there certain kinds of patients where you kind of say to yourself, like, yeah, I can kind of predict that there's more of a likelihood that this patient, for whatever number of reasons, I don't know, is not as apt to benefit from the kind of specific ART work that we do, and they could get as much or better improvement working with someone in the more conventional PT or typical chiropractic care.
So you're asking two of my probably favorite questions. Okay. The
Wow. All
first,
right then.
yeah. Well, the first of which kind of is when might somebody be better off seeing me, right? or what type of circumstances are going to be most well suited to what I do, right? And this is kind of a very common conversation that I have with patients, because the reality is, like, as a chiropractor, and I'll tease, like, we're already the redheaded stepchild of the healthcare industry, and so I can't tell you how often I'm the 10th or greater person
Yes.
that someone saw,
Yeah.
for an issue they've been to just countless other disciplines before they get into our office. So, that's fine as long as we help them eventually, right? But one very common thing that I see, and if we're just going to compare chiro and PT for the moment, and I'll even use sort of these traditional definitions as I've shared so far. Let's say someone has a hip pain and they've been to physical therapy, and traditional physical therapy is going to have them do a ton of hip bridges, and they're going to do band walks, and they're going to be trying to strengthen glutes and do clamshells. And I will tell you, as I tell my patients, like, these things are fundamentally good, okay? That you can't go wrong getting strong, right? But if after even just a few weeks, if that's not really clearly helping this person's problem, then there should be a measure of accountability to say, is this really a weakness issue, right? Is this really a stability problem? Or, and this is what I look at, is this a mobility problem? Okay? Because there are plenty of times, and I mean, I see this, if not every single day, absolutely every week in my office, where someone's care pathway until they got to us was just about strength. And no one first asked the question, does this area of the body move the way it is supposed to? So if I use this idea of a hip, does the hip have access first, let's say, to the amount of rotation that a hip is supposed to have access to?
Hmm.
If I have a rotational deficit and I'm trying to introduce bridges and clamshells and what have you, these are creating some strength, but I would argue quite strongly they are not increasing the amount of rotation that the hip can access. So what I tell my patients is, at times it can. And in fact, I just had a conversation with somebody last week who said, I've been in PT for 3 months and it's really only making my problem worse.
Mm. I've heard that. I hear
And
that quite often, actually. I mean, not excessively, but yeah, it's not uncommon. That's for sure.
right, and let me be clear. The same thing happens with plenty of chiropractors,
Hmm.
okay? Where
Yeah.
if they're just going traditional chiro and they're not thinking comprehensively, like, they can get people into trouble just the same, right? So in a case like this, using a hip, if a hip can't rotate, for example, and we're trying to create strength, there is a pretty strong argument that you can only create strength within the range of motion that you can access. And therefore, these strengthening strategies have a decreased efficiency, right? So then I look at it and say, let's make the hip rotate. I like this line. Let's make the hip work like a hip, okay? If I can make the hip move the way the hip is supposed to move, and we can do this at times with hands-on strategies or unique type of exercise kind of stimulus, that hopefully is quite specific to the limited range of motion, then subsequent to that, these exercises that a person is doing perhaps in PT or within their own like training program, whatever that is, these things are now happening in an environment more conducive to success. In other words, the problem at first was there was a stability correction for a mobility problem. I say, let's introduce a mobility correction for a mobility problem, and then let's make it strong.
Yeah. What I love about that is it aligns a lot with what we think about a lot with patients from a total, with a total different angle. Let's say that, we've kind of talked about this a little bit, and if we have time, we'll get into it a little bit. But let's say someone's got, like they've got a Lyme problem, they've got a mold issue, they've got fibromyalgia by conventional diagnosis, they've also got parasite issues or whatever, and you can't tackle everything at one time. But many times the sequence matters. So it's not to say the person's not getting benefit by treating X or Y, but if you take a different sequence approach, then the person gets better faster and you get more bang for your buck with whatever you're doing as you go down the road, which I think is exactly what you're describing.
Yep. So I just yesterday, in fact, I had a young woman come to see me who I worked with for, I'm going to say, about 6 weeks between April and May.
Hmm.
And unfortunately, in her case, she'd had a labral repair in her right hip, she'd had a meniscus repair in her right knee, and in the process of trying to rehab these issues in PT, she starts to develop what at the time was like really an incapacitating lower back pain. And they decide, like, well, we really can't continue PT because of how bad your back pain is. And then she's in with spine specialists, she's in with neuros, and no one really has a clear plan for how to help her. Thankfully, her mother knew about me through a friend. They come in, and this is a case where after I'm going to forget the time frame, but let's say a year, between two surgeries and a rehab pathway, virtually no one had actually put their hands on her, right? And evaluated for either these movement disparities that I just described and or what we call with ART tissue quality, okay? Which is to say, is this muscle too tight? Okay, and we can talk about what tightness is or is not at times. Or is this tissue adequately elastic and capable of moving in the ways that a tissue is supposed to move?
Mhm.
So I treated her for a few weeks. She was considerably better, just hurting less low back pain, less hip pain, less knee pain. And I said, hey, it's time to go back to PT. And so she went back to PT. And, in a moment like that, usually my kind of last comment is, call me when you need me. Call me
Mm.
if you need me.
Yeah,
Right.
yeah.
And so she ended up on my schedule yesterday and she said, I've been in PT for the last 2 months and I am so much better. And today my hips feel kind of tight and I've got this soreness into my upper back. And I said, okay, great. Well, so happy that PT has gone well. And yesterday's session for her is about as easy as my job gets. I just needed to help loosen some things up. That's
Yeah.
simple, right?
Yeah.
So that's a good example of how these things can really work well together.
Yeah.
They don't have to be exclusive.
Right, right. It doesn't have to be an either or a antagonistic thing. It's a time and place.
That's right. That's right. So, Mark, I'm sorry. You asked me a second question that I wanted to answer, and I'm
Yeah, yeah.
totally
Go ahead. Yeah,
forgetting
yeah.
what it
Please,
was.
please.
No, I'm forgetting what it was. If you could
Oh,
just remind me the part two of that question.
so the first question. Well, the first part was, is a reverse, which I thought you kind of touched on, but the second part was,
Maybe I
are
did.
there patients who you think they might actually benefit more from
Yes.
other techniques than ART
Got it. Okay,
first?
so I suppose to a certain extent, I did kind of answer that indirectly, right? That let's use this idea I said there of mobility versus stability. If someone comes in and tells me that they have hip pain and I'm evaluating the movement of their hip and there's nothing I'm doing that's passively recreating their pain, or it appears, for example, that they have adequate access to range of motion, this is probably not a circumstance that requires an intervention that increases range of motion. This may very well be a case that we just got to get that person working out. Right now, we get into the working out, and the program is fundamental there. Right, there are rules with all exercise and any injury. The first of which I would argue is that we do nothing that aggravates a problem, be it pain or any kind of dysfunction. And throughout kind of a troubleshooting process, hopefully we can figure out, the term I really like is what that person's trainable menu is. Meaning, what are the exercises that this person has access to that are effective, that are getting them better, that are not making anything worse, right? And as they start to progress through this plan, well, we can evolve, right? So yeah, this if I go back to the original comment about the best chiros, the best PTs should be indistinguishable, there are plenty of practices of either discipline out there that this process I'm describing happens without any explanation, right? It's just
Yeah,
what that provider does.
yeah,
So in my mind, yes, I'm a chiropractor. That's the school I went to, but I exist in a gray area somewhere between chiropractic and physical therapy and athletic training and sports medicine and et cetera, et cetera.
yeah. But all we care about is just the results.
That's right.
It doesn't matter. Yeah, very
Yeah,
familiar with the gray area.
yeah,
Can
right.
I can I launch off on your comment about the tissue quality?
Mm,
So I think without going too far into this rabbit hole, but that's a very it's a doorway that opens my thinking about let's talk about a patient. Let's just use for example a patient who has by conventional diagnoses like fibromyalgia, all right, or say like chronic Lyme. And I don't know if I've ever said this to you, but for me. and being a little bit more, I guess, just being a little more particular. If we say within New England, if someone has a diagnosis of fibromyalgia, I'm going to have conservatively 85% confidence or more that this person has a chronic Lyme problem and will get better treating Lyme. Now,
Wow.
having said that, right, a lot of the thinking there is because we know scientifically that a lot of and Lyme is a broader topic of category, which we won't get into, but a lot of those pathogens, those bugs, Borrelia definitely, but not exclusively, they live in these musculoskeletal tissues, right? And so it kind of makes sense. Having said that, on the conventional level, fibromyalgia isn't just a musculoskeletal problem. A lot of it is understood to be a central nervous system problem, like a pain receptor issue from the brain, not just in the peripheral tissues. So all that being said, the question here is, if you were to see a fibromyalgia patient, let's just keep it that simple. When you talk about tissue quality, first of all, do you have any, and this is for my learning, quite frankly, to be truthful here, do you have certain kinds of patients where you kind of go, yeah, there's something different about this patient, and this patient may at least simultaneously or more benefit from therapies that are not even musculoskeletal, like body work related, i.e., like when we treat Lyme disease, we're not, a lot of it is we're treating with antimicrobials, right? Whether they're pharma or non-pharma, but antibiotics of some sort, plus all kinds of other pieces, but we're not doing body work, right? So there are times that you see kind of patients where you go like, this seems like that kind of patient. I don't know how much benefit they're going to get here, but to be determined. Or on the flip side, are there patients like that I'm seeing that I should be thinking they really would benefit a lot more seeing someone like you or doing musculoskeletal work in conjunction, or maybe as a first step instead of like the antimicrobial work?
Well, so maybe you'll laugh, but I think, in healthcare, the answer may be it depends, right?
Yeah, sure,
So, but no, so listen, like I've treated, I mean, too many people with fibromyalgia,
sure.
right?
Yeah, yeah.
And certainly the reason they'd be in my office is because they're hurting, right? And there's going to be some of those folks where there may very well be some tissue quality problem, meaning a person with fibromyalgia could just as readily strain a muscle in their shoulder or their hip or on a broader scope than that, right? And in that sense, varieties of manual therapy will hopefully help them, right? Are we addressing root cause fibromyalgia? I wouldn't think so, okay? But fibromyalgia, or, we could go down a longer list of systemic inflammatory issues and what have you. I would hope that there are treatment strategies in the MSK, musculoskeletal arena, that will help provide some relief, right? May
So
not be
you're saying you,
total.
you do see that on a regular basis?
Sure,
Yeah. Okay.
absolutely.
Yep.
Yeah,
Okay. And that
absolutely.
sustain as well.
Say that again, please.
And that sustain as well.
Uh-huh.
Okay.
Yeah,
Cool.
yeah. There's people I see who they're kind of, we call them like supportive care, if you will, where they're in every few months or more or less, kind of depending on the person, and there may be variability to why they come in. Today might be a shoulder, and 6 months from now might be an ankle, whatever, right? But staying within the fibromyalgia lane there, we know that one of the diagnostic criteria for fibromyalgia is, what is it, 11 out of 14 points have to be tender. This is in my opinion kind of a garbage diagnostic criteria, but that's maybe not the point. What we're talking about is like pressing on tissue. Is this sore? Yes or no, right?
Yeah. Right.
If it is, let's say there's a tissue quality problem. Well, in a moment I'll define this, but if I am assessing tissue and it's sore, right away I'm thinking like, why, right? Why is this tender right here? Is there a movement discrepancy that we can evaluate objectively? Or is there a tissue quality problem? And so I often, when I'm defining this idea of tissue quality to my patients, say, you've probably given somebody a shoulder rub and you've probably felt a knot in their shoulders, a knot, right? Well,
Yeah.
if you feel a knot, you feel a tissue quality difference, right? Where a healthy, happy muscle, and I shouldn't even just say muscle, because the reality is muscle is part of a network of connective tissue, but a happy, healthy tissue is supple, elastic, pliable, okay? And in an area where there is a tissue quality problem, these areas tend to be firmer. Maybe they're tender. They may not always be tender. Pain's an unreliable indicator in that regard of tissue health, okay?
Hmm.
But they're going to be firmer. At times, we use words like leathery, okay, or granular, right?
Yeah.
But it doesn't feel supple and elastic. So all of us have, I would say, the capacity in our hands to sense the the difference in tissue quality. It's, someone like me where I've spent many hours a day for many years evaluating these things. My hands are a little more attuned to it than others, but we all have that ability to determine normal or maybe not.
Okay. Yeah, yeah. Yeah, so I think just from my summary and I guess, yeah, as a totality, yeah, it depends. There definitely are. Yeah, and I think all fibromyalgia patients know this, right? I think a lot of them, I dare say almost all, if not all, they know there's times they're in too much pain and tenderness that they're like, "Okay, I can't I wanna get a massage, but I can't 'cause it's gonna hurt way too much." But yeah, some patients may benefit more than others within that community of diagnosis in regards to either sequencing of, bodywork versus MSK bodywork versus non or simultaneous, et cetera. But, yeah, so maybe something I'll keep in mind and we'll kinda something I might bring up to you again over time as exploration, but, yeah, good to know.
Mark, let me offer yeah, sorry, let me offer just a little bit of perspective because you said an interesting thing in there about I don't want to get a massage, it hurts too much, right? I believe strongly that good manual therapy is more about finesse than force. Anybody can push hard enough that something hurts. That doesn't mean it's good, right?
Sure. Yeah.
We need to be able to meet somebody where they're at. And always in my office, regardless of the severity of someone's problem, I hope I am crystal clear that what we're going to do at times may be uncomfortable because we're working areas that are symptomatic and are painful. But I don't want anything ever to be painful while we work on it. Again, pain's complicated. It's not as simple as, I have a pain in my upper back, and it's not as simple as the muscle in my upper back is the cause of the pain.
Yeah.
It just doesn't work that way. We know that this is about, in many respects, how the nervous system perceives the area where we experience these symptoms. If I'm smashing on that muscle so hard that I am provoking pain, all I do is feed into the altered perception for my nervous system of the symptomatic area. So the provider, whatever discipline they may be, should really be dialing back the intensity of what they're doing to try and meet the person at an area that is more tolerable. Now, what I should add there is, and this absolutely applies in these cases of fibromyalgia or other sort of systemic inflammatory issues, we usually need a team approach, right? And so, if I have somebody with rheumatoid disease, for example, one, are you on medication? Okay. Are Have you ever like had, kind of your food intake evaluated in a way to say like, do we have any type of say inflammatory sensitivities here? I could go down a little bit of a longer line. Are we getting enough water? How's our sleep? How's our stress in our personal life, in our business life? All of these variables have a meaningful effect on something like pain. And so there's plenty of times where, while I may still be able to identify there is a tissue quality thing here, or there's a mobility thing here, there's layers to that onion, right? And there's times where someone has to be co-managed with you, for example, because I can't do it all myself.
Yeah, I think you're speaking again to, yeah, these patients with the inflammatory systemic, the more systemic inflammatory patients. There's a lot of pieces, causes and contributions and elements and such, and so trying to delineate them is often challenging. And yeah, how far patients are able or willing to investigate those different pieces. That's a lot of the question. So I think that, yeah, I didn't say it earlier, but that it certainly aligns with me when you're like, yeah, it's right now it's from our experiences anyway, and it's not in literature, but it's hard to better predict which patients might benefit more from bodywork approach, non-bodywork approach, and I think it comes down to, well, you just have to do an evaluation to at least try to suss that out. If we were to flip the pivot, flip this topic just slightly for the last question here, just last topic, back to tissue quality. All right, because the two things, and maybe if you're willing, maybe we'll do this on another time, right? But I know like you didn't even touch on. I'm sure it's a big topic. The topic about the whole joint capsules, right? So now that I've
Uh,
been in you guys' space with our oldest son, and then last week for the first time with our second kid, and now I've gone for myself just in the last few days. Yeah, you saw me there. That's a theme like of conversation is the joint capsule, and that relates, no doubt, to that rotational range of motion piece you were talking about. But then there's also this other piece I hear Tim talking a lot about, and I've heard you talk about also, which you alluded to just now, which is that whole training the brain, the talking, the messaging between the brain and the external peripheral body, whether it's the joint muscles, whatever the case may be. So all that being said, actually kind of like verbalize that just for my own documentation, if you will. All right. So for later, maybe. But staying on the topic of tissue health, tissue quality, do you have like quick and dirty comments on in a longevity medicine patient, an anti-aging longevity kind of minded patient who's about optimization of health and wellness? Are there certain either specific exercises, activities, or parts of body parts that you would bring a specific attention and focus to as a strong recommendation, kind of, across the board for the population level at large, not being specific to any given individual with a evaluation basis to enhance to give them better, right? I mean, for longevity, a lot of times we're talking about just reducing risk of falls, right? That's kind of like a conventional topic, certainly. But we could be talking about just, it could be strength, it could be about muscle mass, it could be whatever the case may be for you. Loaded questions. I apologize.
Yeah.
Loaded.
No, no, no. This is a great question.
Okay.
I've been paying attention to some of the bigger voices in the longevity space for years, just even just personal interest, professional interest, what have you. And there's consensus that everybody categorically should strength train, right? And everybody categorically should increase cardiorespiratory fitness, right? But the variable that I see, or I would argue, is kind of neglected, and I think it requires some nuance between those two things, is movement, right? That it's one thing to be strong, we all should be, but like I said earlier, we can only be strong within range of motion we can access. And I would argue that increasing movement capacity just across the board of every joint system possible allows us perhaps to demonstrate more strength within range of motion, certainly allows us to move more comfortably, okay? Probably makes efforts like cardiorespiratory training just a little bit easier, right? It just makes generally good movement just makes life easier. And we should add too that
So if I could just briefly ask, so am I correct to interpret this as when you say movement, it's largely synonymous exactly with what you just alluded to with your earlier comment about range of motion and mobility? Is
that's
that
right.
fair? Okay.
That's
So
exactly right.
we're basically on the same topic here.
Yeah. Sorry,
Okay.
I said
Got it.
movement, but I could say mobility. We could say
Okay.
range of motion. I
Sure.
mean, all of the same things.
Got it.
And even if we look at it not just from a musculoskeletal perspective, but movement is enormously important for brain health as well. That one of the ways I've heard this defined is that movement, or the amount of information that ascends from our body relative to movement to the brain, occupies a significant amount of the square footage in the brain. So if we want to have a healthy brain as we age, we had better move our bodies,
Mm,
right?
mm-hmm,
So while I agree wholeheartedly, everybody should strength train. And I agree
mm-hmm.
wholeheartedly, everybody should increase cardiorespiratory fitness. I would love it if somebody in the longevity space would speak up loudly and say, can we also really move our bodies dynamically? Because movement is the single greatest variable that we can control in terms of the health of our joints and our tissues. So if we move a lot, we're apt to, one, maintain access to range of motion indefinitely, assuming there is not unusual injury sort of moments that we
Yeah.
sometimes can't control for, right?
Yeah.
But movement is kind of the prerequisite. If I can move well, arguably every strength training exercise is on the menu, right?
Mm,
If I can move well, every type of cardiovascular training should be on the menu, right?
mm. Makes sense.
So, my opinion, movement should be right up there, somewhere in between strength and cardio on the list of everyone should do this for good longevity practice.
And I'm going to guess that you would say diversity in movement is meaningful as well,
That's absolutely right.
right? Because
Yeah.
I'm thinking there's going to be a lot of people who are like, well, yeah, I walk every day. In fact, I walk like 4 or 5 miles every day. Yeah, and that's not to say it's not to pound the "you're not good enough" message, or that et cetera. It is to encourage that, but it's also to say, but the diversity of what you're doing, throughout a week or a month or whatever, not necessarily every single day, but the diversity matters too, right? Because you still, back to the range of motion, we're gonna be limited in what we're doing with just doing the same old, same old.
Totally, right? That let's use walking or running. even
Yeah,
as
right.
an example. These things are excellent, right? I would never discourage someone from doing these. Listen, unless they have a problem and that behavior is in fact aggravating of the problem, say with running an Achilles injury. If it hurts, my Achilles hurts when I run, then I should probably figure out what's wrong with the Achilles before I keep running. But,
Yeah,
I
common
digress.
sense.
The difficulty, if you will, from a movement perspective with behaviors like walking or running is I'm kind of just moving in a straight line, right? And we know that our body also wants to move laterally, it wants to rotate. Okay, in many different places. So, yeah, let's walk every day. Okay, great. But somewhere within our regular, either just routine behaviors or within our fitness, program, we better utilize other range of motion. We better move dynamically. It's just good,
Yeah.
fundamentally good.
Yeah, yeah. So I that crossed my mind from our son, who I'm sure a lot of his influence is from you guys, because he'll just sit there and tell us about, yeah, I've been watching these videos or this and that, and I've been learning about, like, yeah, just a lot of people as we get older, like, people just, if they would just actually spend more time like on the floor and just practice getting up and down from the floor, like that alone, right? Because people just stop doing that stuff. So it crossed my mind as to, just because I think there would be a lot of people who, when they hear that about movement, and so maybe a last sort of sub question there is like yoga and Pilates. Yoga, Pilates, a lot of people do that kind of work. Would you consider those good sort of range of motion activities as far as like what's common out there in the general population?
They're great, right? I mean, there's virtually no type of exercise that I would vilify, right? I've
Or
seen these arguments out there. What's that?
let me qualify then. If someone's already
Yeah.
doing yoga or Pilates and
Okay.
they're like, okay, if I want to level up a little bit more, what might you suggest there?
Do something else, right? Do something different than yoga. So this raises a good question, right? And there's kind of two. I'd say there's two sides of this spectrum. There's right. They are stretchy. They are bendy. They move all the directions. But I would argue, because I've seen it too many times, that person is lacking some stability. Okay, because a lot of what happens in a practice like that is they are passively accessing all kinds of range of motion. If they just maybe added in one or two strength training endeavors a week, which are more of a stability type of stimulus
Hmm.
versus a very dynamic stretching kind of stimulus, hopefully they achieve a balance there, right? The other side of that spectrum is the bodybuilder, okay?
Yeah,
Who
right,
is exercising with the ambition of more weight, more mass, just thick, 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 right?
right, right,
That person is a movement moron, right?
right.
They have such a decreased access to range of motion
Yeah,
because their goal is honestly more aesthetic, right?
yeah, yeah,
I think everyone's objective should be somewhere in the middle there, okay? Where let's do a system like a yoga or Pilates or there's other things like them, right? Where it's more of a dynamic range of motion focus. But let's also strength train, right? That these things they should exist together.
yeah. How about Tai Chi as a last piece on that?
Another good one. So
How do you fit
Tai
Tai Chi
Chi,
versus Pilates and yoga? Do you have like a preference, or like, no, they're all good?
I think it depends, Mark, on somebody's entry point, right? And so these days, I see a system like Tai Chi recommended often, maybe for an older person, okay, and maybe for different reasons. That older person has not been strength training, for example, or they've been more sedentary. Perhaps something like Tai Chi is, as it is a lower force type of strategy, something that they can access immediately, have reasonable success with it. They're not super, super sore from it or something that might kind of demotivate them, if you will, right? So it's great. It's movement. Okay. And I would hope that if, let's take an elderly person doing Tai Chi and maybe that's their entry point to some type of physical fitness, maybe that opens doors to more stuff as well.
Right. Yeah, I ask about it because Tai Chi does come up historically quite a bit in the longevity world, and I think, again, some of this is like how much is the body movement, the meditations, and et cetera. But I think as a last comment or reflection back from what I heard from you just now is, I'm really going to take home for myself that comment you made about the brain stimulation from the tissues, where people are always, because when people think about brain health, right, in the longevity world, patients are always asking, and I hear other people just socially talking about, like, yeah, Sudoku, or doing Brain HQ or whatever the apps are, right, just to keep my brain active. And you're sort of teaching, reminding me at least, I'm sure not just me, that, hey, a lot of the brain stimulation, like you don't even have to actively do in terms of a cognitive function. A lot of that is happening in it sort of automatically without you knowing it just from the movement, which I think goes back to that one of those two topics that maybe for another time about that whole retraining and messaging of the rewiring of the brain and the peripheral body tissues and such. So there's something there that I'll be reflecting on more, and maybe we'll have a chance on another time. But I think I'm
Great.
assuming that's fair interpretation. I love that piece. And again, then yeah, whether it's Tai Chi, Pilates, yoga, et cetera, like, hey, they're all good. Diversity is good. And maybe that's where for someone who's already active on some level, if you're kind of more monotonous with what you do, or it's been a long time with the same pattern, then diversifying might be your next step to level up.
That's exactly right. Yep. Yep. There's some of the kind of things that I often advocate is that number one, like regarding activity, physical activity, nothing is inherently bad.
Yeah, yeah,
Everything is a question of prerequisite, right? Do I possess prerequisite range of motion, for example, to perform this physical task safely? Okay. If I do, have at it, right?
yeah,
And if I don't have prerequisite kind of capacity for this task, what's the hardest variation of this task that I can do successfully? That's
yeah.
my objective, right?
Yep.
Always movement.
Yep. No, I love that. I had no agenda on what that response might be, and just threw it out there. Sorry if some of these questions are a little bit complicated or loaded.
I like it.
I have a lot of thoughts that kind of I try to cram together in one kind of question. But this is awesome. I look, our goal really, my goal with these podcast sessions is more about for patient, or general population education, sometimes practitioners too. I know a lot of colleagues who do podcasts regularly. They love like learning on their own. That's not necessarily it's not at all my top one or two objectives, but I learned a ton from this. I knew I would. So thanks. I know we've gotten to know each other a lot better. And again, last glaze, like, yeah, I saw Tim myself 2 days ago, and that elbow thing, I was like, yeah, it's not happening. I'm not able to get back on the pickleball court, which I think you probably know. It's gone a little nutso for me. So you're gonna have to tell him I said thanks. It's
For
I've
sure.
had
I
the
would.
experience myself now, and I told him to keep my expectations in check though, right? He said when do you want to play again? It's like yesterday, but I'm trying to keep my expectations. He said, I think you're gonna be good by this weekend. I was like, don't tell me that, man. Don't tell me that. Tell me it's gonna be a couple weeks or something, right? But here I am 2 days later. I'm like, man, I think I am going to be able to go this weekend. So
Well, so Mark, maybe I'll end then one more little bit of advice there that if we do have a pain like an elbow, let's say, and you want to play pickleball, right? Work as hard as you can safely, right? What's the threshold? Okay, can I play for 20 minutes and feel great, but 30 minutes it's aggravated? Play for 20 minutes, right?
that's my thing. That's my
Yeah.
thing. I told him and a couple, our son or daughter, both of them. I was like, my biggest problem is I'm gonna feel like I want to go hog wild when I go back. So self discipline, self control. Hey, this is awesome, Mike. I really appreciate it. So again, so the practice where Mike and Tim are at, North Shore Spine and Sport is the name here in Newport, Mass. The website is northshoreспинesport.com. You can even make appointments online. I got to tell you that when I told that last patient who I just gave you that text update on when we started, that's why I told him he loved that. Right. I was like, a lot of times I give people the information and whatnot. But I was like, hey, you could just make the appointment right online. And he's like, even better. And 10 minutes later, he's texting me back. Like, I'm all set.
There we
So
go.
awesome stuff. You guys are doing great work. Everyone in the community knows you guys have high reputation. And I'm just sort of like seeing it with even more eyes wide open. Hey, you weren't kidding when you told me recently. I kind of, I'll dare say, sent to you guys, if you will, 3 or 4 like really hard cases in the last 3 months, and you were updating me along the way. And I've had that feedback from them. Like been eyes wide open for me. So honor and credit to you guys, and keep up your great work. That's how people can reach you. Anything else you want people to know about you?
No, just really appreciate the time, Mark. Thanks, man.
No, it's great. It's awesome. And a lot of parallels there with what we do on the RootSeek side, but that's for another time. So thanks for your
Yeah.
time. Awesome
Thanks,
stuff.
Mark.
All right. Talk to you again.
See ya.